while the health sector is a sector that continues to be growing, and there is a lot of opportunities for jobs, and women are still in the workplace, the front lines of the pandemic have been very difficult working environments with very little psychosocial support and just general workplaces that aren't necessarily always the safest, particularly for women. This includes that many women have reported that they haven't had access to personal protective equipment, PPE, and when they have had access, it's often ill-fitting and not made for women's bodies. And I like to often remind health systems are designed by men for men, but we need to start recognizing that health systems are for everyone, and especially women are 70% of the health and care workforce. So we must design health systems to acknowledge the health and care workforce and really support women in the workplace. And enabling environments mean include them in leadership, include them in really protecting them from all forms of harassment and violence, addressing the pay issues, which again, many women in the health and care workforce, especially the frontline community health workers, have been reporting they're not getting living wages. In countries like India, ASHA workers were again part of the frontline community health workers, report they're only making $30 a month, which is below poverty line. So these are really, stark issues. And I also mentioned protecting and supporting healthcare workers to providing them vaccines and appropriate PPE. So these are some of the issues that are unique to really the health systems aspect, where we see that there is a greater burden on women. Why this matters? One of the things is we believe the health sector can be exemplar in gender equity for other sectors. It is one of the fastest growing economic sectors, one of the biggest employers of women, and we aim to really call for gender transformative action. And in the health and care sector, we say that if we do this in a gender transformative way, we'll see a triple gender dividend if we invest in safe and decent and equal jobs. This includes women will fill those jobs. That leads to their economic empowerment, which is the gender dividend. We also know that when you have a health job created, it fuels other jobs, which leads to a broader development dividend. And of course, only through having a well-supported health workforce will we achieve the health dividend in our universal health coverage agenda, but also our health security agenda. So for us, we really say the health sector is a model for us, if we did it in a gender equitable way, to be the exemplar sector. Looking at the pandemic, one number that really stands out when it comes to women's leadership is that when Women in Global Health looked at 115 COVID-19 task teams around the world from 87 countries, we found that 85% of those task teams are majority men. And if we continue to sideline the expertise of women, especially women that are at the front line of this pandemic, we will continue to lose out, and we'll be missing out on the critical knowledge that's needed to, again, address the current pandemic and build back.